Several organisations carrying out healthcare education are now turning their skills and contacts into coping with the COVID-19 pandemic. One of these groups is the Centre for HIV-AIDS Prevention Studies, or CHAPS. Their jobs had been educating communities on the advantages of medical male circumcision. However, they're now being roped into the COVID-19 fight. Jacqueline Pienaar is the CEO of CHAPS. She joins us now via Zoom. Jacqueline, good evening to you. First, your organisation was doing one thing in terms of helping with male circumcision. Then it had to basically change tack completely and work on educating communities around COVID-19. How difficult was it to make that change?
Good evening. Sorry, I missed your last sentence.
How difficult was it to make the change from education about male circumcision to COVID-19?
I would say that it's quite a challenge, but the principles underlying public health response and public health measures are adaptable. So especially in the infectious disease portfolios, you can find the underlying principles that enables you to rapidly pivot your response to the emerging public health crises.
You can't just change your material, though. I mean, in a way, you'd need to change some of your actual approach. You have to really sort of start and think again.
Absolutely, yes. So based on, as I mentioned, your underlying principles, drawing from your existing technical resources, such as specialists, medical practitioners, etc., you find the synergies that you've yielded before in your core business. But it is important, especially in the public health field, for agencies such as ours to remain nimble and flexible to the ever-changing public health environment.
You work at HIV-AIDS Prevention Studies. You're literally one of the world experts in this if you work in that study, in that centre in South Africa. Has government learned all of the lessons from HIV prevention in terms of COVID-19 prevention, or have there been lessons that maybe have been missed?
I think that there's quite a few lessons that we failed to deploy in our current COVID-19 response. We have such a dearth of knowledge and experience, especially as South Africa is the epicenter of the HIV epidemic. And unfortunately, with the COVID-19 crises, what we've seen in the field is almost a reinvention of practices that we've already mastered over the last 2 decades in our HIV response.
So could we have managed this better, building on that knowledge, do you think?
So, for example, community participation being front and center. Rolling out what we've learned with the HIV epidemic is you can't just parachute in support services into communities. Because of the diverse cultural and contextual landscape across South Africa, you can't employ a one-size-fits-all model, which is generally what officials try to do in public health for ease and for efficiency. However, it doesn't yield the impact of the results that you would like to see or would need to see. And in this case, with COVID-19, we yet again missed that ball in terms of placing the community first when you are mounting a public health response.
Jacqueline Pienaar, thanks very much indeed, CEO of the Centre for HIV-AIDS Prevention Studies with us today. Do appreciate the time. Coming up, more travel news, still no international flights, but domestic routes, they are expanding under advanced level 3. Stay with us here on The Pulse.